So the question is right now, what we need to do the good transesophageal echo examination. Yes.
Yeah, so first of all, you have to know the history of this patient more or less. You have to do transthoracic, at least basic transthoracic study, or just read the results of your colleagues who did it. It's good to do some auscultation as well. And you have to ask the patient briefly about swallowing problems in the past, because some people may have such a history. And then you have to take informed consent. The patient must know what you're going to do. You never approach the patient who doesn't know what you're going to do with him, and specifically when you want to insert the probe into the esophagus. Also, in the echo lab, you have to make sure that the probe is properly disinfected. So you do it with specific fluids, like Sidex, for example, Sidex OPA. But remember that, can you keep it for me? So this probe is water resistant up to here, but you cannot really put any fluid on this electronic part. And specifically, you must not put any water in the plug, because this contains very sophisticated, connectors. And if you make it wet, it will probably die. Then, of course, we have to talk to the patient and inform, okay, you're going to swallow this probe. This is that thick, but don't be afraid. During the swallowing, you will have to bend your head like this, and then do several swallowings to allow the probe to go there. So I'm not going to force it. You have to cooperate with me, and then it's going to be fine. And also, you have to tell him that, okay, during the examination, when this probe is in the esophagus, he will not be able to swallow the saliva, because it's blocked, right, by the probe. So
you have to make him this.
You saw in the echo. Yeah, so you have to rotate the head like this to let it flow outside. So of course you have to prepare all these covers to keep
make
it there.
Possible, yes, and clean. Yeah.
Yeah, and only after the patient knows what's going on, he or she must sign the informed consent, and then you can start. Of course, the patient must be fasting for at least 6 hours before the study, unless you have really, very, very important indications. It's good to have IV line. You have to connect the cables for ECG. It's good to have oxygen nearby, and also check the saturation during the study to make sure that the patient is okay. And of course, before you go into the esophagus, you have to remove any prosthesis of the teeth from the mouth. And in most of laboratories, we give midazolam or other substances that make the patient a little relaxed before we start.